Welcome to the Ask Dr. Deanna show. I'm Dr. Deanna Holgren, your host. Join me weekly as I cover various health-related lifestyle medicine topics that you get to request. This show is for anyone who wants to proactively improve their health position. I hope you enjoy the show. Welcome to the Ask Dr. Deanna show. I'm excited that you're with me today, and you're going to love the information that I share today, especially if you're struggling with issues like autoimmune diseases, gastrointestinal problems, anxiety, depression, arthritis. We're going to unpack a lot of those issues today. I often tell my patients that I don't want to just manage diseases. I actually want to reverse them. I think that the current medical approach is a little misguided because in med school, I was taught to manage disease states rather than to cure or reverse them. In lifestyle medicine, we are taught how to actually look at disease processes, find the root cause, and basically reverse that disease. And this is best accomplished through root cause assessment, through evaluation of a patient's symptoms, looking at what all they're struggling with, everything that they have going on, and then considering what all the possible options are. What could this be? What might this patient have? And then basically start by eliminating each one thing at a time until you come to a really good diagnosis. And today, one of the things I want to talk about is the gut root, also known as gut dysbiosis. I like to call it gut rot. The symptoms of gut dysbiosis, or as I call it, gut rot, are things like upset stomach. Some people have gastroesophageal reflux disease, autoimmune issues, allergies, malnutrition, anxiety, depression, cognitive decline, bloating, diarrhea, constipation. Sounds horrible, right? These are issues that people are dealing with every day, and they're looking for good solutions. This is where that old adage, you are what you eat, actually comes into play. The cause of these gut issues or this gut dysbiosis is actually a product of the standard American diet. So many people in the United States are actually overfed but malnourished. So the issue with the standard American diet is that it's loaded with things like gluten, artificial ingredients, lots of chemicals, and then a chemical that causes so much disruption in the body, glyphosate. Glyphosate is a big issue in the diet, and glyphosate works through something called the Shikimadi pathway, which I know is all sciencey, but basically it's a pathway by which the product glyphosate interferes with or disrupts the microbiome, the natural gut bugs. And so what happens is we basically end up with this toxic food or this chemical soup, if you will, that really causes microbiome disruption. Microbiome disruption leads to autoimmune diseases. If you look at the use of glyphosate in the United States, it has absolutely skyrocketed, as have autoimmune diseases. There are so many autoimmune diseases that I was taught in medical school, I would never see them, yet they're commonplace in my practice today. According to a 2019 American Psychiatric Association textbook on neuropsychiatry and clinical neurosciences, glyphosate actually leads to behavioral disturbances via microbiome disruption. So let me share a little story with you. I have a patient who is a second grade student. This second grade student came to me with his mother, and they were looking for some alternative therapies for his behavioral disturbance. The child had been diagnosed with a behavioral disturbance called oppositional defiant disorder. He really struggled with his behavior in the classroom and was often disruptive, sometimes violent, sometimes having to be removed from the classroom. We decided to do a full micronutrient assessment on him and found that he was deficient in so many nutrients. And the root cause of that deficiency was actually the gut. It was that his gut was not allowing him to absorb the nutrients because there was inflammation in the gut, and that basically he had been eating a processed food diet. So we started with a gut program, gave the child some probiotics, gave him some supplements for the things that he was deficient in, the nutrients that he was deficient in. And basically, I saw the child back about 3 months later. I was absolutely shocked at the difference. He was well behaved. He was happy. He was thriving in school. And he told me a story. And the story was that he had just recently watched another kid from his classroom who had to be taken out, which means that basically they were disruptive and they had to leave the class. He said that this student was kicking and screaming and even threw a chair. Hard to believe, I know, in the second grade, but these things do happen. And so anyway, he said he felt embarrassed. And when I asked him, why did you feel embarrassed? He said, I felt embarrassed because that used to be me. And I feel so much better now. So that's just a perfect example of the difference that good nutrition makes and healthy gut microbiome makes. So one of the things that we see often is gluten as an issue. So when you look at the gut and this inflammation, the gut not being able to absorb micronutrients, gluten can be a culprit. About half of us are sensitive to gluten. Some are highly allergic to it. And I always like to say that gluten causes intestinal road rash. So if you were to go running out through the parking lot and you went sliding across the concrete and you kind of skinned yourself up, well, imagine that's what's going on the inside of the gut if you are in fact sensitive to gluten. When this happens, you've got inflammation and that interferes with the absorption of key nutrients. You end up with sometimes inflamed joints, an inflamed gut, an inflamed brain as well. And this is a big issue that is at the root of so many diseases that we see today. Dysbiosis is the alteration of the flora in our intestinal tract by environmental agents or chemicals, causing a reduction of the number of beneficial bacteria and increasing the number of pathogenic bacteria in the gut. Things like salmonella and clostridium are highly resistant to glyphosate, and salmonella and clostridium are not good for your gut at all. But the healthy gut bugs like Enterococcus, bifidobacteria, and lactobacillus are especially susceptible to glyphosate through that Shikimadi pathway that I mentioned earlier. So what I'm saying is that the glyphosate, which is found in Cheerios and Goldfish and a variety of other food products that most people eat, interferes with your gut's natural microbiome, rendering the healthy microbes ineffective and unable to work, unable to do their job, which then leads to disease processes. These bad pathogens induce a breakdown in what's called the tight junctions in the cell lining of the gut and leads to something called leaky gut or leaky gut syndrome. Beneficial bacteria can protect from celiac disease through their enzymatic activities on gluten. Pathogenic bacteria attack the cell wall. The integrity of the intestinal wall is essential in the defense and prevention of intestinal inflammation, infections, and leaky gut. Let's talk about the gut-brain connection for a minute. This connection has an impact on the endocrine system, on the immune system, as well as neural pathways. Invasion of pathogenic microbes, as I mentioned earlier, leads to an autoimmune response because macromolecules end up entering the bloodstream through the leaky gut. This sets up autoimmunity, and that would be things like arthritis and Parkinson's disease and thyroid issues, type 1 diabetes, adrenal insufficiency, which is becoming more and more common, liver diseases, etc. In addition to the autoimmune issues, there are many, many neuropsychiatric symptoms that basically are a product of these pesticides, glyphosate, or organophosphates, carbamates, organochlorines. Glyphosate can actually induce anxiety, irritability, tremors, Parkinson's type tremors. And organophosphates can lead to weaknesses, headaches, bronchospasm, and can even cause some severe psychiatric disturbances as well as some convulsions. So these are toxic ingredients that are in our foods that are making their way into our food. And, my personal opinion is that we have a right to clean food. I have a right to real food, to clean food. I don't want this toxic chemical soup. I don't want to put it in my body because I know it's going to cause problems. In addition to the autoimmune issues, there are very serious central nervous system issues that come from this, like the behavioral issues that I mentioned earlier, anxiety, depression, and so many others. Let's talk about reversal. Okay, here's the good part. This is what I really want you to get. This is the takeaway. And the takeaway is this: your body has the amazing ability to repair itself. So many times, if you eliminate the offending agent, what's really derailing you, and you give the body what it needs, it has the ability to repair itself, and you get great results from that. So the first thing that you do is to eliminate the offending agent. And the offending agent here is the standard American diet. It's the artificial foods. It's the artificial additives, the chemicals that are in all of these processed products. Eliminating things like hydrogenated oils, trans fats, gluten, artificial colors, artificial flavors, artificial sweeteners, high fructose corn syrup. High fructose corn syrup actually causes hepatotoxicity. That's a whole nother topic that we'll get into on another day. But basically, you want to eat clean food, real food. You want to replace and replenish your gut microbiome. You can do this with probiotics. You can do this with fermented foods. I like probiotics that include things like Saccharomyces, Bifidobacterium, Lactobacillus, Acidophilus. I always say green, green, green. You want to eat lots of green vegetables. Green vegetables not only alkalinize your body so that you have the right pH, which is also going to help restore the gut microbiome, but you also want to include healthy fats. Okay, those healthy fats, especially omega-3 essential fats, are going to help improve those tight junctions in between the cell and help improve or repair that leaky gut issue. They also help with decreasing the inflammation. And then finally, restoration. It takes time. Your gut didn't get messed up. The autoimmune issues didn't happen overnight. It takes time to heal a gut, to replace or replenish the microbiome. And this is going to take good nutrition. It's going to take time. It's going to take rest. But it is possible. It can be done. So many people have had great success with this program. I know it sounds simple, but it absolutely works. And all of this and more is covered in Dr. Deanna's Healing Handbook. If you suffer with gut issues, autoimmune issues, or mental health issues like anxiety or depression, I hope this has given you hope. Restoration is possible, and many people are finding that this is a much better alternative to taking a medication or a pill. This is truly what lifestyle medicine is about: changing your diet, changing your lifestyle to be able to reap tremendous benefits. For more information about healing the gut, you can go to deannaholdren.com. Join us in the upcoming weeks as we unpack the fascinating world of nutrigenomics, talk a little bit about hormone balance, a little about anxiety and depression, and so much more. To request topics, visit me at deannaholdren.com. And remember, you are what you eat, so make sure you pay attention to what you're eating. Thanks for joining me. Have a great day. I hope you enjoyed that episode. For more information, visit me at deannaholdren.com. Find me on Facebook, Instagram, and Twitter at Dr. Deanna Holdren. I really want to hear from you, so message me. I love taking your messages and creating topics from them. Please rate, review, subscribe, and share my show with those who have an interest in health and wellness. Thank you for tuning in, and see you next week.